And next, I'd like to introduce to you our Lieutenant Governor, Antonio Delgado, who was born and raised right here in Schenectady, currently resides in Rhinebeck with his wife and his twin boys. Graduate of Colgate University, earned a Rhodes Scholarship, received a law degree from Harvard Law School, spent the next 5 years as a hip hop artist, I understand, in LA, which is the best credential that I could come up with. Following that, he was a corporate attorney doing complex litigation, then went into the House of Representatives, elected to the House in 2018, became the Lieutenant Governor in 2022, was elected, re-elected, or elected, I guess, for the first time in November of 22, and we're very happy to have him here today to address our audience. Lieutenant Governor.
That was the lady I was talking to, the gray-haired lady. Yeah, she clearly she doesn't understand why the states allow life insurance companies to have.
Lou, thank you very much for the
It's like, this is why
introduction and the trip down memory lane. Yes, I was a hip hop artist.
we're evil.
Clearly, I was not successful. I want to say it's an honor to be with you all today to share with you some of the ways our administration is working to support our older adults, persons with disabilities, and their families through the state's master plan for aging in the recently enacted state budget, as well as speak to some other important state initiatives. I want to applaud you for being a part of today's program and taking the opportunity for learning and professional development across so many important specialty areas. You are on the front lines of efforts to ensure that older adults and persons with disabilities have necessary supports, resources, knowledge, and most importantly, a voice to age successfully in communities throughout our state, building on New York's status as the first designated age-friendly state in the country. It is especially meaningful to meet you today during Older Americans Month in May, a time to recognize the many contributions of older adults, honoring their mentorship, wisdom, and past and present service to our state and country. I want to thank Greg Olson, Director of the New York State Office for the Aging, and Carol Rodat for the New York State Department of Health for being here and for their roles in supporting older adults and for their contributions to the state of New York. I know that many of you have been intricately involved in the governor's master plan for aging by serving on work groups, participating in town halls and listening sessions, or providing input into the process in many other ways. Thank you for your involvement in this landmark process that will establish a path forward for enacting and enhancing New York's status as an age-friendly state. New York's master plan for aging is developing a blueprint for near-term and long-term solutions to support older adults and their families holistically across the lifespan, including a wide range of proposals now under consideration. We understand that the aging process begins when we are born, and a holistic approach is critical to ensure that individuals of all ages can grow up and grow older successfully. That is our goal, advancing programs and policies which have a positive impact in making New York the healthiest state in the nation. It is no small charge, but we are confident that together, with the dedicated and bright minds in this room and joining us virtually, and in every corner of the state, we can achieve this goal. The needs, opportunities, and wishes of older adults are diverse and multifaceted, which is why the Master Plan for Aging has offered a holistic cross-systems approach, bringing together over 500 stakeholders and a council of state agencies. Together, we can meet this diverse and broad-based mandate across many areas, from community planning to housing, from transportation to health services, from economic security to community-based services and supports, housing to mental health, and more. It has long been recognized that, regardless of age, we as people engage with many different systems, not just one state agency, program, or service. Our goal is better coordination and connecting the dots so that policy development and implementation are not siloed. According to the data from the New York Office for the Aging, 72% of older adults consider their overall health to be, quote, excellent or good. Our goal is to help maintain that overall good health while also focusing on the 28% of older adults who may need some sort of assistance so that we can support them better and more efficiently, starting with prevention and supports in the community to avoid higher levels and higher cost services. The Office of the Aging statewide data also shows that the vast majority of older adults view their community as an excellent or a good place to live. The Master Plan for Aging is considering ways that we can continue to strengthen the state's built environment to support individuals of all ages through housing, workforce, transportation, service infrastructure, and more. Also, 71% of older adults say they are very likely or somewhat likely to remain in their community throughout retirement. By better coordinating all of our assets and improving the community infrastructure, we can not only keep people in New York, but also elevate the perception of New York as a destination, a place sought after to live, to work, and to retire. While we celebrate the resilience of older adults and their contributions to healthy communities, we also recognize that many serious challenges remain, including in areas like housing, access to direct care services, the need for a better connection between existing healthcare and community-based wrap-around services, helping individuals access important economic benefits that they are eligible for, and more. I see our goals as twofold. First, ensuring the continued success of those older adults who are healthy, active, and engaged. Secondly, strengthening the safety net and creating a forward path to help those experiencing changes as they grow older, those experiencing economic insecurity, caregiver stress, or the myriad of other challenges to successfully aging in place. While the Master Plan for Aging is a short and intermediate and long-term plan as well to advance New York's age-friendly initiatives, the recently enacted state budget takes some important immediate action steps toward addressing these holistic needs, much in the spirit of the Master Plan for Aging. For aging and healthcare services specifically, this includes a $37 billion investment to support the healthcare safety net and transform the healthcare delivery system, eliminating insulin co-payments for New Yorkers enrolled in state-regulated insurance plans, combating medical debt by banning hospitals from suing patients who make less than 400% of the federal poverty line. Additional funds to help local offices for the aging and their efforts to direct resources towards locally determined, demonstrated service needs. Housing, another key component. Affordability, sustainability, and security are all vital to achieving independence and to successfully aging in place. In fact, housing ranks among the most prevalent concerns raised by older adults as Master Plan for Aging community engagement events are happening. The Office for the Aging's first ever statewide needs assessment survey data confirms this priority, with 69% of older adults voicing concerns about the availability of affordable, quality housing. Governor Hochul's priority in terms of his housing plan was finally agreed upon this year with the legislature. To address this need for older adults and all New Yorkers, the state budget includes a landmark agreement to build more housing, protect tenants and homeowners, eliminate price gouging for renters, protect consumers from evictions, a measure to protect homeowners from deed theft, and combat housing discrimination in Section 8, and affordable housing providers. Just a few of the important items for older adults in the state budget. We look forward to continuing this work through the Master Plan for Aging. We're also working to ensure New Yorkers have access to career development and job placement services at every stage of life. The New York State Office for the Aging and the New York State Department of Labor are working to launch a bureau to support older workers through retraining and reskilling and job matching. We believe that older New Yorkers who wish to continue working are an asset to businesses and can help address worker shortages all throughout New York. Finally, as we reflect on Older America's Month, I think of the 1 million older adults in New York State who are giving back through their volunteerism and service. In fact, the Office for the Aging recently honored 100 of these exceptional individuals during its recent Older New Yorkers Day event. At a statewide level, the volunteer contributions of older adults translate to an economic value of $13.8 billion, directly supporting the functions of nonprofits, charities, human services organizations, schools, healthcare institutions, community groups, and more. With 1 in 7 jobs in New York being in the non-for-profit sector, older New Yorkers are a critical part of the caring economy. To them, the benefits of volunteerism and civic participation are widespread. Volunteers are healthier, less depressed, less isolated. Studies show positive outcomes in overall health, physical and cognitive functioning. Recognizing the vital role that this level of service plays in the lives of New Yorkers, I'm honored to oversee the new New York State Office of Service and Civic Engagement. This office will provide another way to increase community engagement, enhance connectedness and well-being, and continue to maximize the human services infrastructure necessary to meet the needs, challenges, and opportunities of an aging population. I just also would note, it also would speak to the growing need for us to build our capacity to love each other in, I think, incredibly divisive and difficult times. Any chance we get to create these pathways to service, these pathways to see our shared humanity, we should embrace them wholeheartedly. And I look forward to the many ways that older New Yorkers can be part of this enterprise and lend their experience, their wisdom, and their knowledge and intellect, and their spirit. In conclusion, I just want to say thank you again for the opportunity to speak with all of you today and for all that you do on behalf of older adults and persons with disabilities. It's truly an honor to be in partnership with every single one of you, and I appreciate you. God bless.